Indication and usage. UZEDY, risperidone, extended release injectable suspension for subcutaneous use is indicated for the treatment of schizophrenia in adults. Important safety information warning. Increased mortality in elderly patients with dementia-related psychosis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. UZEDY is not approved for use in patients with dementia-related psychosis and has not been studied in this patient population. Please see the important safety information later in this video and full prescribing information for UZEDY, including boxed warning, available at UZEDYHCP.com.
Hello, my name is Layla Gulen, and on behalf of NP-PA Engage, I want to welcome you to this segment of Ask the Experts. Today, we're discussing UZEDY for schizophrenia in adults. Specifically, we'll be looking at the pharmacokinetic and efficacy data. I'm very excited to have joining me an expert in the field. Amber Hoberg is a psychiatric mental health nurse practitioner who has spoken on psychiatric topics nationwide and has served on steering committees for psych conferences. She has treated schizophrenia and other psychiatric conditions for the past 14 years. She currently works for Baptist Health System and Morningstar Family Medicine, PLLC, treating the chronically mentally ill in both inpatient and outpatient settings. Welcome, Amber.
Thank you so much. I appreciate it. I'm so excited to be here today.
So let's jump right in. Can you tell us about UZEDY's pharmacokinetic data and how this long-acting injectable works?
UZEDY delivers the antipsychotic risperidone using the drug delivery platform SteadyTech. After subcutaneous injection, the polymer solution in SteadyTech absorbs water and forms a depot. Some risperidone is immediately released, while the depot traps the remaining risperidone for continuous release over 1 month or 2 months. Over time, hydrolysis degrades the polymer matrix, leading to a steady release of risperidone over the dosing interval. PK studies show that a single dose of UZEDY reached therapeutic plasma concentrations within 6 to 24 hours. Each dose demonstrated a rapid absorption phase and allowed UZEDY to be initiated with a single injection with no loading dose or oral supplementation needed. The rapid absorption phase is followed by a slower secondary absorption phase over several weeks, and then a steady exponential decline. The plasma concentrations of risperidone and 9-hydroxyrisperidone, the active metabolite of risperidone, persisted above therapeutic threshold throughout the entire 1 month or 2 month dosing periods.
Excellent description of how the LAI works over the dosing period. Let's dive into efficacy now. What clinical trial data can help HCPs understand if UZEDY might help reduce relapse for their patients?
The RISE Phase 3 study was designed to assess relapse prevention and maintenance of stability in patients with schizophrenia. RISE was a double-blind, placebo-controlled, randomized relapse prevention study designed to compare UZEDY once monthly and once every 2 months with placebo in patients with schizophrenia. UZEDY once monthly significantly reduced the risk of relapse by 80% compared with placebo, with a hazard ratio of 0.200, 95% confidence interval 0.109 to 0.367, with a p-value of less than 0.0001. Time to relapse was prolonged by 5 times compared with placebo. UZEDY once every 2 months significantly reduced the risk of relapse by 62.5% compared with placebo, with a hazard ratio of 0.375, 95% confidence interval 0.227 to 0.618, with a p-value of less than 0.0001. Sustained relapse prevention was shown at week 24 and 1 year in exploratory analysis. At week 24, relapse-free rates of patients receiving UZEDY once monthly, with 93% compared with 72% in the placebo group. At 1 year, relapse-free rates of patients receiving UZEDY once monthly, with 92% compared with 63% in the placebo group.
It sounds like UZEDY might be a good treatment option for sustained relapse prevention for appropriate patients. What about PAN scores in the RISE study?
One exploratory endpoint in the RISE trial was the change in the PANS at end of treatment compared with baseline after oral stabilization. Even after having undergone stabilization on oral risperidone, patients treated with UZEDY in both dosing interval groups showed continued improvement in symptoms based on reduction in PAN scores compared with those in the placebo group.
What do HCPs and patients think about UZEDY?
Companion survey data were collected from 63 patients, 24 physicians, and 25 nurses in a prospective cross-sectional companion survey, assessing the perceptions regarding ease of use and satisfaction with UZEDY. The survey was administered after a minimum of 2 experiences prescribing, administering, or receiving UZEDY. 9 out of 10 providers and patients report overall satisfaction, and this is consistent with my experience.
How do you utilize this in your practice?
For me, I have a lot of patients on oral risperidone, and being able to offer a subcutaneous injectable option gives my patients the freedom of not having to remember to take pills to treat their schizophrenia, because their medication is available over the 1 month and 2 month intervals. I have found that many of my patients, when offered a subcutaneous LAI, UZEDY, like not having to remember to take a pill every day. UZEDY demonstrates therapeutic plasma levels in 6 to 24 hours, which makes it easy for the patient not to have to take oral overlap. When I have asked my patients their view of UZEDY, many have told me that they would recommend it to others as a treatment option to discuss with their doctor.
Great. Thank you so much, Amber. This was extremely informative, and we're so happy you joined us today to share your expertise.
Thank you so much. I hope the viewers find this information insightful and helpful. Indication and usage. UZEDY, risperidone, extended release injectable suspension for subcutaneous use is indicated for the treatment of schizophrenia in adults. Important safety information warning. Increased mortality in elderly patients with dementia-related psychosis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. UZEDY is not approved for use in patients with dementia-related psychosis and has not been studied in this patient population. Contraindications. UZEDY is contraindicated in patients with a known hypersensitivity to risperidone, its metabolite paliperidone, or to any of its components. Hypersensitivity reactions, including anaphylactic reactions and angioedema, have been reported in patients treated with risperidone or paliperidone. Warnings and precautions. Cerebrovascular adverse reactions. In trials of elderly patients with dementia-related psychosis, there was a significantly higher incidence of cerebrovascular adverse events, e.g., stroke, transient ischemic attack, including fatalities in patients treated with oral risperidone compared to placebo. UZEDY is not approved for use in patients with dementia-related psychosis. Neuroleptic malignant syndrome, NMS. NMS, a potentially fatal symptom complex, has been reported in association with antipsychotic drugs. Clinical manifestations of NMS are hyperpyrexia, muscle rigidity, altered mental status, including delirium and autonomic instability, irregular pulse or blood pressure, tachycardia, diaphoresis, and cardiac dysrhythmia. Additional signs may include elevated creatine phosphokinase, myoglobinuria, rhabdomyolysis, and acute renal failure. If NMS is suspected, immediately discontinue UZEDY and provide symptomatic treatment and monitoring. Tardive dyskinesia, TD. TD, a syndrome consisting of potentially irreversible involuntary dyskinetic movements, may develop in patients treated with antipsychotic drugs. Although the prevalence of the syndrome appears to be highest among the elderly, especially elderly women, it is impossible to predict which patients will develop the syndrome. Whether antipsychotic drug products differ in their potential to cause TD is unknown. The risk of developing TD and the likelihood that it will become irreversible are believed to increase with the duration of treatment and the cumulative dose. The syndrome can develop after relatively brief treatment periods, even at low doses. It may also occur after discontinuation. TD may remit partially or completely if antipsychotic treatment is discontinued. Antipsychotic treatment itself, however, may suppress or partially suppress the signs and symptoms of the syndrome, possibly masking the underlying process. The effect that symptomatic suppression has upon the long-term course of the syndrome is unknown. If signs and symptoms of TD appear in a patient treated with UZEDY, drug discontinuation should be considered. However, some patients may require treatment with UZEDY despite the presence of the syndrome. In patients who do require chronic treatment, use the lowest dose and the shortest duration of treatment, producing a satisfactory clinical response. Periodically, reassess the need for continued treatment. Metabolic changes. Atypical antipsychotic drugs have been associated with metabolic changes that may increase cardiovascular, cerebrovascular risk. These metabolic changes include hyperglycemia, dyslipidemia, and body weight gain. While all of the drugs in the class have been shown to produce some metabolic changes, each drug has its own specific risk profile. Hyperglycemia and diabetes mellitus, DM. In some cases, extreme and associated with ketoacidosis or hyperosmolar coma or death have been reported in patients treated with atypical antipsychotics, including risperidone. Patients with an established diagnosis of DM who are started on atypical antipsychotics, including UZEDY, should be monitored regularly for worsening of glucose control. Patients with risk factors for DM, e.g. obesity, family history of diabetes, who are starting treatment with atypical antipsychotics, including UZEDY, should undergo fasting blood glucose, FBG, testing at the beginning of treatment and periodically during treatment. Any patient treated with atypical antipsychotics, including UZEDY, should be monitored for symptoms of hyperglycemia, including polydipsia, polyuria, polyphagia, and weakness. Patients who develop symptoms of hyperglycemia during treatment with atypical antipsychotics, including UZEDY, should undergo FBG testing. In some cases, hyperglycemia has resolved when the atypical antipsychotic, including risperidone, was discontinued. However, some patients required continuation of anti-diabetic treatment despite discontinuation of risperidone. Dyslipidemia has been observed in patients treated with atypical antipsychotics. Weight gain has been observed with atypical antipsychotic use. Monitoring weight is recommended. Hyperprolactinemia. As with other drugs that antagonize dopamine D2 receptors, risperidone elevates prolactin levels, and the elevation persists during chronic administration. Risperidone is associated with higher levels of prolactin elevation than other antipsychotic agents. Orthostatic hypotension and syncope. UZEDY may induce orthostatic hypotension associated with dizziness, tachycardia, and in some patients, syncope. UZEDY should be used with particular caution in patients with known cardiovascular disease, cerebrovascular disease, and conditions which would predispose patients to hypotension, and in the elderly and patients with renal or hepatic impairment. Monitoring of orthostatic vital signs should be considered in all such patients, and a dose reduction should be considered if hypotension occurs. Clinically significant hypotension has been observed with concomitant use of oral risperidone and antihypertensive medication. Falls. Antipsychotics, including UZEDY, may cause somnolence, postural hypotension, motor and sensory instability, which may lead to falls and consequently fractures or other fall-related injuries. Somnolence, postural hypotension, motor and sensory instability have been reported with the use of risperidone. For patients, particularly the elderly, with diseases, conditions, or medications that could exacerbate these effects, assess the risk of falls when initiating antipsychotic treatment and recurrently for patients on long-term antipsychotic therapy. Leukopenia, neutropenia, and agranulocytosis have been reported with antipsychotic agents, including risperidone. In patients with a pre-existing history of a clinically significant low white blood cell count, WBC, or absolute neutrophil count, ANC, or a history of drug-induced leukopenia or neutropenia, perform a complete blood count, CBC, frequently during the first few months of therapy. In such patients, consider discontinuation of UZEDY at the first sign of a clinically significant decline in WBC in the absence of other causative factors. Monitor patients with clinically significant neutropenia for fever or other symptoms or signs of infection and treat promptly if such symptoms or signs occur. Discontinue UZEDY in patients with ANC less than 1,000 cubic millimeters and follow their WBC until recovery. Potential for cognitive and motor impairment. UZEDY, like other antipsychotics, may cause somnolence and has the potential to impair judgment, thinking, and motor skills. Somnolence was a commonly reported adverse reaction associated with oral risperidone treatment. Caution patients about operating hazardous machinery, including motor vehicles, until they are reasonably certain that treatment with UZEDY does not affect them adversely. Seizures. During pre-marketing studies of oral risperidone in adult patients with schizophrenia, seizures occurred in 0.3% of patients, 9 out of 2,607 patients. 2, in association with hyponatremia. Use UZEDY cautiously in patients with a history of seizures or other conditions that potentially lower the seizure threshold. Dysphagia. Esophageal dysmotility and aspiration have been associated with antipsychotic drug use. Antipsychotic drugs, including UZEDY, should be used cautiously in patients at risk for aspiration. Priapism has been reported during post-marketing surveillance for other risperidone products. A case of priapism was reported in pre-market studies of UZEDY. Severe priapism may require surgical intervention. Body temperature regulation. Disruption of the body's ability to reduce core body temperature has been attributed to antipsychotic agents. Both hyperthermia and hypothermia have been reported in association with oral risperidone use. Strenuous exercise, exposure to extreme heat, dehydration, and anticholinergic medications may contribute to an elevation in core body temperature. Use UZEDY with caution in patients who experience these conditions. Adverse reactions. The most common adverse reactions with risperidone, greater than or equal to 5% and greater than placebo, were Parkinsonism, akathisia, dystonia, tremor, sedation, dizziness, anxiety, blurred vision, nausea, vomiting, upper abdominal pain, stomach discomfort, dyspepsia, diarrhea, salivary hypersecretion, constipation, dry mouth, increased appetite, increased weight, fatigue, rash, nasal congestion, upper respiratory tract infection, nasopharyngitis, and pharyngolaryngeal pain. The most common injection site reactions with UZEDY, greater than or equal to 5% and greater than placebo, were pruritus and nodule. Drug interactions. Carbamazepine and other strong CYP3A4 inducers decrease plasma concentrations of risperidone. Fluoxetine, paroxetine, and other strong CYP2D6 inhibitors increase risperidone plasma concentration. Due to additive pharmacologic effects, the concomitant use of centrally acting drugs, including alcohol, may increase nervous system disorders. UZEDY may enhance the hypotensive effects of other therapeutic agents with this potential. UZEDY may antagonize the pharmacologic effects of dopamine agonists. Concomitant use with methylphenidate, when there is change in dosage of either medication, may increase the risk of extrapyramidal symptoms, EPS. Use in specific populations, pregnancy, may cause EPS and/or withdrawal symptoms in neonates with third trimester exposure. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to atypical antipsychotics, including UZEDY during pregnancy. Healthcare providers are encouraged to register patients by contacting the National Pregnancy Registry for Atypical Antipsychotics at 1-866-961-2388 or online at womensmentalhealth.org, Clinical and Research Programs Pregnancy Registry. Lactation. Infants exposed to risperidone through breast milk should be monitored for excess sedation, failure to thrive, jitteriness, and EPS. Fertility. UZEDY may cause a reversible reduction in fertility in females. Pediatric use. Safety and effectiveness of UZEDY have not been established in pediatric patients. Renal or hepatic impairment. Carefully titrate on oral risperidone up to at least 2 milligrams daily before initiating treatment with UZEDY. Patients with Parkinson's disease or dementia with Lewy bodies can experience increased sensitivity to UZEDY. Manifestations and features are consistent with NMS. Please see the full prescribing information for UZEDY, including box warning.